Hello, everyone, and welcome back to the CLSR. And I'm your host, the counselor. Today, we're going to be talking about part two of addictions, and we need to get a clear understanding that addictions can be described as anything from a desire to have or to do something that gives pleasure, like a medical issue, to an uncontrollable compulsion. And it's a term some health professionals referred to as substance use problems or straight up addiction or substance dependence. These are a couple terms that are commonly used when referring to addictions. And see, today we're going to be talking about treatment. We're going to get a little bit more in depth on treatment and how um, you understand what the process is like. I believe it's important for us to get a general idea of what happens during treatment, right? It can be different to many different people. However, we'll go with what typically happens, right? So, what's going to happen is once you encounter a trained staff member, which is in every treatment formula, someone has to be trained, educated on it. It's not something that you guess about. Serious business. So each treatment service, you have to make sure you have a trained professional in that area. Okay. Um, and these professionals will do a number of things, and which could include plan a treatment for you, link you to other services that you might need, help you learn some skills for leading a healthier life, more balanced life, help you set some goals and possibly meet those goals with their assistance, provide some individual or group counseling, and they could offer support and information for family members, even help you to learn how to avoid or cope with some of the slips and relapses that you may encounter yourself, or understand it if it's happening to someone close to you when they slip or relapse. And that means they using their substance and they stop and then they go back into it, or they keep sliding in and out of it, right? And these trained staff members should be able to help you prepare a plan for what will happen after treatment. So, they'll give you opportunities to explore how this substance use affects your life. hmm And cost. This is another thing. Because we are in a country, so, I have listeners listening from all different parts of the world. So I'd have to say I'm talking specifically about the country I'm in the province I'm in, which is Ontario. And for the most part, they cover the fees, the basic fees. That means there's no charge by you or to you, sorry, as a resident of Ontario. However, if you're not a resident, that could be a whole different story. Then it gets into more costly fees, right? But if you're an Ontario resident, you qualify for the basic health coverage, which it will cover definitely some addiction services for sure. And there may be fees that are not covered. So you have to find that out yourself. But generally, for the most part, the housing, the treatment plan, those are generally covered, but there may be fees that might not be covered, like specific medications that you may be given. But also, in other parts of the world, it's going to be totally different. They might not even have the resources or support. They might even have more, depending on which country you live in, for sure. So you'd have to look into that yourself. But generally speaking, here, a lot of it's covered under our general health coverage. It's called OHIP. It's called the Ontario Health Insurance Plan. So, how long would you stay in treatment? Because people want to know this. It depends on the service and how much help you need and the goals that you are trying to achieve. You know, it can range from a few weeks or to several months and possibly longer, you know. And how do you know if possibly you need help with your withdrawal? See, because withdrawal symptoms are more likely if a substance use is stopped suddenly. So you don't want to go into treatment. You got to be careful. And I don't want to scare anybody, but just be aware that when you do seek treatment, um, you have to be aware of what you can kind of take, because if you're going into a treatment center, you have to be open and upfront with your use. Because if you get into the treatment center and you find that you're going to relapse because they're cutting you off directly, they're like, you know what, you're here, you're not getting nothing, this that. Usually don't work like that. They try to do an assessment of what your wants and needs are, so you have to be upfront. But if your substance use is stopped suddenly rather than reduced over time, you're going to get some symptoms of withdrawal, and they're going to vary. And they really vary depending upon the substance you use or maybe your health condition. This could be a factor too, right? Like if you have a health condition and it's for some reason you're using substances, and any withdrawal from them could impact you. And this can happen within hours or days of stopping the use. You could get depressed, distressed, feel ill. You might even want to refer to as what they call withdrawal management support, right? Detoxification or detox, you know. And this is a process in itself where you get some withdrawal management services, right? Where you either have to wait for a spot, and all this is a place where you can withdraw quietly. And I know they can range, and I know it ranges from weeks to possibly a month, sometimes less. And the detoxification unit, I actually worked in one before. And I gotta let you know, it's a process. A lot of people get the wrong impression about detox units, especially in the inner city. Detox units are places where you could dry out. Um, like for all intents and purposes, let me just clarify what goes on with detox unit. People think you can walk in tore up off the street into a detox unit. That's not correct. They don't just take anyone. People think, oh, if you're on the street or if you're tore up, you know what I mean, and you're really drunk, you can just go to a detox center. Not true. They will not take certain people under certain conditions. A lot of times, you have to go and talk to someone in there and schedule something, whether it's an intake date or they could take you depending on spaces available. I don't want to give you the impression that if you need to, before you start taking your treatment, you might have to withdraw. Well, listen, I might need help. I can't just go in a treatment center and just cut cold turkey. So I might have to go somewhere where I have some counselors, right? So usually what happens in a detox center is they'll either talk to you for a bit, interview for a little bit, fill out a questionnaire about your usage, and just to decide, number one, if they can assist you, if it's the right place for you, right? Get an idea, and they'll be able to see if they have any beds available, or they can refer you to another area where there are beds. But what it is a place where they will house you, monitor you, right? They have a defibrillator, because some people get to the extreme where their health is like, if they withdraw off some medication, they could go into cardiac arrest. So they do have defibrillators there, but they will check you when you come in, ask you some questions, check your physical person, make sure you're not carrying. They'll outline the rules to you, right? If you're staying in a detox center, they'll let you know, like, this is what support we offer. These are our expectations, which will include no usage. If you use, this is what will happen. It's usually a 2 to 3 step process. They want you, and they don't really bother you when you go in initially. Like if you need to withdraw, and that means withdraw. Like you just want to cut cold turkey, and you want to be in a safe place, and you want to be where you could get some referral if needed. There's usually a purpose to it, but a lot of times it's about just drying out, trying to see if you can dry out and get some support. So what happens is they will house you, feed you, clothe you, let you shower, take your pills, and ask you to do certain things around to be helpful, but they don't expect a lot from you. They'll have their separate smoke rooms. There will be different people with different addictions there. They'll ask you to be respectful of that. And you know what? The it's a place where you're going to get some support, and there are wonderful people in the addiction. Usually you will find that at least one staff member may be possibly a former addict. So they're going to have an idea of what you're going through. So keep that in mind. People like to hire people who are aware of, what you're going through, and they can kind of relate. And if they understand about addictions, then they'll understand about your triggers or your irritabilities, things that will work with you or not. So we're fortunate to have these programs for sure. But usually they're in hospitals or connected or near a hospital. Hospitals have a tendency to refer their clients that come in through emergency to um, the withdrawal place or building or center. And usually you got to sign in, right? Like you got to sign your approval that you're going to enter yourself into this service, this withdrawal service. And there are different ones. There are medical and non-medical, depending on your needs. You know, they could even be managed in your own home, right? This medical withdrawal management service. It depends on the safest route, you know, like, and it depends on you. Like, if you have a history of severe withdrawal, like example, seizures, hallucinations, or if you're dependent on more than one drug, that's going to be a determinant. And if you have a physical illness, that withdrawal symptoms could get even worse if they withdraw your substance use from you. Like if you have diabetes or high blood pressure or heart disease or possibly pregnant. That is really going to depend too, right, on what type of withdrawal service you get or placement that you receive. But you got to check with, in our country, DART it's called. I told you about DART, DART.on.ca if you're in this country. However, if you're in another country, you're going to have to find out what resources or services are available. But speak to a medical professional. They'll start you um, on the path. So, like, if you're looking for information on substance use for pregnancy, because I just mentioned pregnancy, especially during pregnancy, it's scary. But if you're on substance, on some sort of substance while you're pregnant or you're using, or while breastfeeding, you got to get some information. And where can you get that information? Because you have to be aware that the impact on your baby, was alcohol or drugs while pregnant or breastfeeding, you know, you got to ask yourself one question: is it safe for my child? Do I want to take chances? Well, some people don't ask themselves that question. They were addicted. The pregnancy happened, but they still have their addiction. So they have to make sure that they're going online to find out these things. So um, there's a waiting process. First of all, it's not just the immediate run in there and everybody's going to be at your whim, at your attention. No, it's you're going to have somewhat of a waiting process. Not long, sometimes a lot less. So what can you do for these waiting periods for some formal treatment? Because they are quite common and they can be disturbing and stressful for you. However, you need to be aware that for some of these treatment programs, they do offer orientation, right? Like some sort of orientation to get you started. These are little groups that they have that you can attend while you're waiting on your notification for their actual treatment. They put you on a waiting list, and you can call around to different agencies and put your name on different lists, and whichever one gets you in quicker. Just know that there are groups, self-help meetings. So these things are put in place, these orientation groups, for just supporting you along the way. They could help enlist some of your family and friends who do not use substances. It could be your faith community. You try some counseling services, even outside the addiction treatment system, ones that are available. Just going to start the process wherever you can get in. You know what I mean? Um, and just remember, it's not a one off. And there are people out there, I tell you, they will tell you and they will tell you. And if you listen, they will tell you, "Oh, I've been through treatment before. It sucks. It doesn't work. It's different for different people, you know." And even if you've been through treatment before, what is the harm in trying again? I mean, nothing works perfect the first time. Very rarely. You have to put work into it. I think we've gotten to the point where we are so used to getting and receiving so quickly that we lack patience anymore. But what's the harm? You know what I mean? In trying again. If treatment doesn't work, keep trying. You know what I mean? Work at it. You know, this if this didn't work, work at something else. You know, there are a lot of you might see, oh, there's no real point in trying again. I've tried that already. You know, while returning to substance use after treatment, it can be discouraging. It is common that people do it, but it's not a reason to give up. Not at all. Do not lose hope, because if you want to have lasting success, it takes more, a lot more than one, possibly several treatment experiences or attempts to quit or cut down. And people who have been addicted to cigarettes, right? Nicotine, these things, rarely it's a one off where you go, "Oh, you know what, I'm done." It happens, but usually it's over a number of attempts. You have to consider different treatment approaches, and they could be various treatments, but you might need to find one that's good for you. You know, one that's more specifically catered to you and your needs, right? Think of the programs that are out there. There's programs that exist for Aboriginal people, for women, right? People addicted to cocaine, concurrent addiction, and mental health problems. You know, sometimes people return back to the same treatment program and have greater success. It's just about continuing to try. Keep trying. The lasting change is very possible. You have to be aware of your treatment options. Think about yourself as a project. You're going to need work. You're going to be successful in some areas, and in other areas you're not going to be so successful, but you have to complete the project. You have to work through it. A scary question for a number of people is, I know I need change, but how do I start that change? How do I make some change? You know, and some are able to make it on their own, and others benefit from seeking help. There's no one size fits all. Just make sure that you're meeting for some assessment by a professional, a counselor, physician, whatever. Make sure that you have been properly assessed to determine those strengths and needs. And I mean, there are self help approaches out there. It could be hard taking that first step, but the self help resource, you know, simply grab that phone, get active, go to a treatment service. You're not alone. You are far from alone. You might feel alone often. You might think that no one cares, or you might think that no one can help. But you making the move, that's a crucial step in the process. Understanding you're not alone, understanding this can be temporary and you can get through it, is very, very vital to your sustained recovery. But you need to consider some of these self help approaches. And I think about self change. And these are people with substance use problems. They're able to make some changes on their own using some self help materials, books, websites, brochures, right? They explore many causes and effects of the substance use, and they learn ways to stop or reduce their use and plan and set goals for the future. If you can do that, I applaud you. keep it up, you're working on yourself, beautiful. However, it's not the case in all cases. So if you can't take that step and do it by yourself, look for some self-help groups. They call them mutual aid groups or support people who are working to help you change your substance use. And there are advantages to actively engaging in self-help groups for this continuous support, right? These people are there because they're looking for lifelong change. They know when you get into these addictions that, in order for you to stay on track, you're going to need support, and it's long-term work. People in these groups have a clear understanding that it could be lifelong. Of course, many of you have heard of one of the oldest organizations out there. It's called the AA. It's one of the largest self-help organizations in the world. And I think it started in the 1930s. Um, it's Alcoholics Anonymous. And they have the view that alcohol addiction is a disease that requires lifelong abstinence from all substances. There are many self-help groups for people with substance use problems, with a variety of philosophies out there and approaches. And a lot of them through the AA, they take this approach. And it's a 12-step approach that they utilize in their program. Not everyone's for it, but it's something that has helped many millions of people over the years. Right? And these are for people who just want to cut down on their substance use and get their lives back. And there's even CA that many people don't know about. It's Cocaine Anonymous, right? And it's basically a double recovery initiative for the addiction and mental health issues. You know what I mean? Moderation Management. That's another program. Narcotics Anonymous, NA. Nicotine Anonymous, Nick A. Secular organizations for sobriety, right? Trying to stay sober. Smart recoveries. Self-management and recovery training. And for women for sobriety, the WFS. Many of these groups, you can access them online. The internet is good for getting access to certain organizations, but watch the information on the internet. Okay, be careful. Be a little weary of what you're reading out there. Make sure that you're not just skipping steps and trying for quick fixes or making recommendations for loved ones or colleagues based on what you read off the internet. It's not really the approach that you should take. And what you need to understand is when it comes to treatment centers, they've taken the realization, right? They have the understanding that there are a lot of people who need treatment that aren't going to be able to just stop once they walk in the door. So they have a harm reduction program, which is for individuals who are not really ready to quit or able to give up all their substances. So some treatments programs, they've adopted this harm reduction program and this approach. And it's just simply geared towards people who just, they may be willing to stop using one substance but not the other. Or they may have a goal of abstinence, or they are not following it. So really, in actuality, they do not have a goal of abstinence, right? Or they're not ready to change their substance use. But more than likely, they seek treatment if it does not require abstinence, And the mindset has changed over the last 30 years. It's taken a while, but it still needs a lot of work in a lot of countries. People don't understand about addictions. It's sad, but rarely it's a quick fix and you just stop using. Like, there has to be some measures, and thank goodness we have programs who offer a compassion, right? They understand the needs of the client, the needs of the patient. the needs of the people. They understand that there is no one off. And that's a beautiful thing where you can give people a sense of hope, where you could still empower them to know what's good for them and not judge them. And if you can offer a program that can help, you know, like them wean themselves off or just sustain a livable life. That's what it is. It's not a fix. It's a help. It's a guidance. It's a support. It's an understanding. It's a compassion. It's a realization that we matter, and we need organizations out there to take this thing and run with it, understanding that different people have different needs, and what's good for you isn't always good for them. And just trying to get people to have productive lives is a blessing in itself. And that's what we should be working at when it comes to treatment or helping, you know. It's really weird, the word treatment, eh? It has the word treat in it. So weird. Treatment. Oh. Anyways, so just know that for many people with these substance use problems, abstinence might be the most desirable goal, especially in the eyes of their family and some treatment providers. However, the harm reduction approach, it offers an alternative, right? Ways for them to reduce the harm of the substance they're using, you know, and the impact it may have on the community. It might be less aggressive, less intrusive, and less destructive if they're on harm reduction. Many people don't agree with it. They're like, oh, they're still addicts. Stop pointing a finger. It's not an easy choice, but it's a choice. And so, what are some harm reduction strategies that are out there? Well, simply put, some of the strategies that are actually used today are substituting a safer drug for the one a person is using, like methadone for heroin. Heroin's more destructive, so you substitute that, right? It's less harmful on them. Or if they're helping to ensure that the person's basic needs, such as food and shelter and medical care, are met, right? We haven't talked about AIDS or HIV in a long time, but providing clean needles and other injection equipment for injection drug use to reduce the transmission of infections such as HIV, AIDS, hepatitis C through needle sharing. And that scares a lot of people, scares a lot of communities, right? Because that's a big fight. You know, these harm reduction models, they're challenged. People say, oh, you know what? There's needles all over. We don't believe in it. You know, we find them here, find them there. Well, that's what the problem is that these people are going to find needles in parks, around children, around schools, near buildings, in parks, you know, in all kinds of areas. If we don't understand that we need to provide safe places, an addict is going to go in places where they're out of the public eye for the time being, you know, and these could be unsafe places for our children, for others. So how do we protect them and ourselves? Well, we offer proper places for people to, you know, reduce the harm that they have. If they can do treatment, fine. A lot of people fight harm reduction programs. You know, they protest against it strongly. However, there are countries that have shown that it helps, and it helps prevent death. That's just one thing, you know, in a lot of cases, right? But we still have those challenges out there. We have those judges, those people who are willing to point the finger and say, you know what, that's not good enough. Well, we're going to keep dealing with it. So let's keep up the good fight. However, there's also medications to treat addictions besides this harm reduction, right? People looking for help to quit smoking, using that patch, you know, the inhaler, the gum, right? You know, you want to double up the chance of quitting and not starting again. But people who are on heroin or opioids, codeine, Percodan, Oxycontin, you know, the effective treatments are methadone or Zyban. And these are substitutes for opioid drugs. And they just kind of help prevent withdrawal and reduce cravings without causing a person to get high. See, these people are stable on these medications and they can function in society. They can work, they can go to school, they can drive a car. And this treatment usually lasts approximately a year. However, it could continue longer depending on the circumstances. It could even go on for years. Uh, and to be honest, the treatments for other addictions can be limited. For example, when we talk about alcohol, what treatment is there really for alcohol? Well, one treatment is Revia, naltrexone, it's called. But a lot of people refer to it as Revia. And what it does is it reduces cravings to drinking people who are alcohol dependent, right? It blocks the effects of even the opioids. Also, there's disulfiram, right? Antabuse, it's called, which causes people to feel sick. You've heard of it. They feel sick or nauseous if they drink the alcohol. So when they take that, it makes them throw up. They feel really sick, so they don't drink anymore. I've heard of that for sure. That's commonly recommended. Uh, However, um, there are no real treatments to treat cocaine addiction or methamphetamines. We like to think there are, but unfortunately, there's really no real treatment except for complete abstinence. Um, so let's be aware of the treatment services out there. And remember, it could range from short term to long term. It could be from withdrawal management, like the detox, like complete or partial withdrawal from substances, individual or group counseling, brief, 8 sessions or fewer. You could get longer term counseling if it's offered in your community, but usually that's roughly what it is. And there's day or residential treatment. Participants attend a variety of individual or group counseling sessions lasting all day for up to 3 weeks generally. And it's usually day treatment. And they sometimes even return home at night or on weekends after this treatment. The long term residential treatment, that, like I said, lasts 6 weeks to 6 months. And we have our recovery homes out in the communities and, recovery homes and therapeutic communities, right? Where the participants live in a supportive housing complex or a single home with the staff or other people recovering from the addiction. And these residents are expected to abstain from all non prescribed substances. And they're expected to work or attend school outside that facility. And then we have the aftercare. And this helps people who have completed a treatment program to return to the community and avoid relapse. Sometimes that might be a colleague or a friend who they check in with. And what does it look like? Uh, it varies. As we mentioned earlier, it varies. It just, some may incorporate culturally specific traditional or spiritual components to it, right? And they'll outline elements of treatment within the program. So, you have to look out for the counseling, which comes in a variety of forms, including the individual, group, couple, or family. Uh, and what is the aim of counseling? And we just need to know that, just for information's sake, it's really to increase people's awareness of how substance use affects their lives and really what puts them at risk, right, of this use, and what practical changes they can make to reduce their substance use. And it allows them to examine the thoughts and emotions that they have, right, or if they've experienced in the past. Help them learn how these experiences affect how they behave and how they interact with their surroundings, their environment, and with others, and how people see them. And counseling is also there to promote physical, emotional, spiritual wellness for individuals, right? And it helps them learn to manage their cravings, their temptations, their use for substances, and meet their needs through assessment and communication. Basically, develop a healthy lifestyle. Find ways to meet people and form relationships that aren't focused on substance use. And if you can, reduce that stress. That's beautiful as well. But I'm a big proponent of education. I believe it always has a part in every treatment form. There has to be some form of education on the part of the individual if they're working towards recovery. For example, like alcohol and drug education, learning about it. I think if you're an alcoholic and or addicted to alcohol, then understanding the effects of alcohol and other drugs can help make you more aware of what it's doing to your body, your life, and others around you. And education also will help you with deciding a proper treatment program, and offer alcohol and other drug educations to maybe people that that might be struggling with it as well. Giving them some information. You know, but there are holistic approaches to treatment that offer a variety of other supports and services, unlike the ones that I said. Like there are, when it comes to counseling, even think about this. Like you're gonna have counseling sessions that deal with stress and anger management, grief and trauma, healthy eating, finding a job, getting back to school, dealing with the pandemic, accessing safe and affordable housing, getting social assistance, disability benefits, managing money and budgeting, developing parenting skills, dealing with depression, dealing with oppression, right? They can offer help in all these different areas, and they can refer you to other services based upon your needs, right? And they can even act as your advocates and linking you to some other resources that you may need. There are a number of services out there. However, you might need to um, access a service that's specific to your needs. So realize that there are a number of services, such as the Aboriginal people offering traditional healing approaches, right? Specific cultures in a variety of languages. These are programs that help people from all different cultural ethnicities and speak different languages. They can help. The lesbian, gay, bisexual, transsexual, transgender, two spirited, intersex, and queer or questioning. What do they call that? The LGBTTTIQQ, right? That communities, and also the elderly, specific to older adults, youth, women, men, differently able people, people involved in the criminal justice system, immigrants, refugees, concurrent addiction and mental health problem, people who use specific substances such as cocaine, heroin, nicotine, and solvents, involving alternative treatment approaches such as acupuncture, hypnotism, and meditation. These do help. There's a variety of, and see, what I mentioned are specific populations with specific issues, but there are wonderful resources out there that we're blessed to have. However, people have to use them. Smoking is one of the biggest ones that's a very big challenge. 80% of people who are dependent on alcohol or other drugs also smoke cigarettes. It's 3 times higher than the general population. So, substance use problems, quitting cigarettes can be even harder when you have alcohol and other drugs. It's just like a snowball effect. Some people say, when I'm drinking, oh, I have to have a what? I have to have a smoke. If I don't have a smoke, oof, it's just not right. But people do. They combo up, right? And oddly enough, smoking is responsible for far more deaths than alcohol. Illegal drugs, HIV, Hep C, suicide, murder, motor vehicle accidents combined. Smoking is a guaranteed death certificate. People don't realize it, or they don't care. It doesn't matter. Or they're oblivious, or they're in denial. But quitting or reducing smoking is worth the effort. Believe me, it helps you when you quit smoking. It helps you with the other problems too, to abstain from alcohol and other drugs. It really does. Giving up cigarettes. it can be such a worrisome habit to have. It's so complex. It's not easy. However, giving it up is just a weight lifted off your shoulders, right? So if you're trying to go towards recovery, you're working on that, working down that path, you know, you got to take one step, and that is take action. Make it your mission to take one step at a time. So when we talk about making change, we have to think about recovery and relapse prevention. So when you do make change, you have to get ready for change. You talk about it, you read, you educate it, you think about it, but you have to be ready for change. And people with substance use problems often put off getting some help or attending help groups. And it's usually because they're not sure, or they're not ready, or they're not able, or they don't even want to quit smoking, for example, or using those substances. So they're feeling ambivalent about the change. And that's very normal. Deciding to change is astronomical. It's a very big step for a lot of people. And most organizations, treatment facilities, they understand that it is a process treatment, right? So this self help, they welcome people who are not ready to make full change, but they're ready to start their journey. And they want to maybe explore, or they want to see how this change could impact their lives. So if you are an individual that is thinking of change, it's important that you set some goals for change. So when you decide that you're going to make some change for your life, depending upon your situation and where you are in the process of this change, you may consider some of your choices, like abstain, like not using substances at all, or reducing the use of substances, or actually stop using one drug but still continue to use the other one. You might even make the decision that you're going to reduce the harm that you're causing upon yourself. Like, for example, if you're going to stop drinking and driving, but you still continue to drink, which is common in a lot of people. So you set those goals for yourself, right? And it's different for different people. You're going to find it hard to stop, you know, but you might come to the realization that abstinences is more realistic for you, but another might not choose that path. So there has to be an understanding that for change to occur, you have to realize it occurs in stages, because it can be hard and it can take a long time, but it is a process. Rarely happens all at once, usually in stage. And in your initial stage of the change process, you have to understand pre-contemplation, right? Which is people not connecting their substance use to their problems they are having. So if substance use is not a problem, why even think of changing? But these people get assessed, and they might see something different. They might realize through this assessment that these substances are actually causing some problems. The substance use, right? So they need to find a new way of thinking. So the pre-contemplation is that first stage that we have to realize, right? People see that not so good things are occurring when they're using. And they may be torn between seeing these things and the good feelings that they have, right? And at some point, there's this not so good things might begin to outweigh the good things. And then this imbalance could go and back and forth, right? Which through time usually leads to the preparation stage. In this stage, people decide to change and come up with realistic strategies, such as attending a treatment program or going to a self help program or setting a date to make some change when it comes to their substance use. But once people actually start to make some changes by reducing their smoking or reducing their drinking, they are in the action stage. They're actually doing something. And when they continue with these changes for 2 to 6 months, they're in the maintenance stage, right? And that is so important to understand, right? The maintenance stage. And these stages that they go through, it's like a revolving circle. And while this cycle is going on, you remember you're going to get into the relapse stage where they can slip in again, right? And start using again. And this is slipping back and forth, right? It's called relapse, slipping backwards. Well, it's always better to try to avoid relapse. However, it does occur, and what people learn from it can help them. It could help them bring about some lasting change. So we have the contemplation stage, right? The contemplation, preparation, maintenance, the action. All these different stages play a part in changing. For instance, the pre contemplation stage. What strategies you're going to implement are simply understanding that even if you're not convinced you need to change, keep track of your substance use, write it down. Write down how you're feeling, where you were and who you were with. Give more information about the role substance uses in your life and consider exploring your use to determine whether or not it's a problem. Take, take hold and take stock and be real with yourself. Consider making an appointment for an addiction assessment. Ask a friend or family member how he or she feels about your substance use. And be realistic with yourself. And write down the pros and the cons of changing your substance use. And this is also included in your second phase, which is the contemplation stage. Ask yourself, what do I need in order to be able to change? As well, think about what's important to me, my family, my job, my health, and how does this substance use affect it? And remember, don't be discouraged if you're not clear about making the change. Many people feel that way. So as you move from the pre-contemplation to the contemplation stage, and you move into your preparation stage, set your goal for change. Like, give yourself a quit date, a target for cutting down or cutting back that use. Right? Learn about the programs, addiction programs that are out there and the services they offer. And mind yourself of your reasons for making a change. Try not to expect big changes and don't minimize the small changes. Everything counts. Get the support from family and friends. And always try to think about the strengths and supports that will help you change. Right? So as we move from the pre-contemplation to the contemplation to the preparation, we're moving into the action stage where you do have to take action. You have to seek some support from others if you can't do it yourself, from the friends, families, and professionals. You got to attend an addiction treatment. You have to actually avoid people and places and things that put you at risk of exceeding your substances use. And I know that's going to be hard for many people because they're raised in families where substance use and abuse runs rampant. It's almost become a part of their cultural identity. And you might feel like an outsider if you kind of shy away from that. However, you're going to have to fight that for the greater good, which is you. Looking at you, saying, listen, I matter. I don't have to have this community circle if it's not healthy for me. What's good for me? Explore other treatment options. And it may be medication under a doctor to reduce the cravings and possibly residential treatment. It is a stage that you're going to have to weigh your options. So once you get out of that action stage and you really have put yourself forth, you have to go into the maintenance stage. Be aware of some of your urges and your temptations, and try to keep away from substance use. Continue to remind yourself the reasons why you're doing this. Why are you making this change? Reward yourself for making the change. Do something for you that you enjoy, a happy and activity that you have fun in. Don't reward yourself, though, with alcohol or drugs. See, too often we are rewarding ourselves with, oh, usually I have 5 beers, I'm only having 1 beer. No, 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 no. Don't use substances at all to reward yourself, right? And consider attending a relapse program, right? For prevention, a relapse prevention program for the aftercare or the self help group. Understanding that it could be a lifelong affliction to you, right? And managing. After this, you might have to go back through these phases again, or start off with one and keep revisiting and starting from a new point. It could be an ongoing thing, but you need to manage a relapse. It could be hard to stop a substance, and you could just get right into an environment where you are being teased with it. It's in your face. It is hard. It's hard to stop. You're trying your best, but you keep being in there. You have to start managing. It's not surprising that people who make these changes may return to problem drinking or substance use. No, you know, because it can make you feel vulnerable and weak, right? When you go through this process, it may seem like recovery is impossible, you know, and relapse does happen in many cases. But you have to regard it as a temporary setback. Learn from it, pull from it, pull some strength. Don't see it as a failure. Look for continuous growth. Understand you'll slip, but you can get right back up and keep going. Look for the positive changes that you've maintained. Some things that are very positive, like using less of a drug, less often. That's positive. You're maintaining a positive lifestyle. That's positive. Staying in school, keeping up with your work, keeping your relationships intact, not using during, your work hours or during class or when you're with friends, having the strength to sustain a positive lifestyle moving forward. Just understanding that you are reducing or eliminating other high risk behaviors, right? And that's good for you. We talk about relapse, and that's scary for a lot of reasons, very valid reasons. What causes relapse? Why do people relapse? They're doing so well, and then they relapse. It becomes 6 months to a year. Oh, I've been a 2 year. Something happens somewhere, and they beat themselves up about it, right? So, what are the causes of relapse? And there are triggers that could put people at risk of relapsing back into that old pattern of behavior. And some of the causes could be negative emotional states, right? Like the anger, trauma, stress, sadness, isolation, loneliness, right? If you got this physical discomfort, withdrawal symptoms, or physical pain, or you're not using anymore, and you can't eat anything. So what do? You try to, you know, get it to the point where you're functioning again or you're feeling better. So you just go to the drug or the substance. What also could happen is you're in a positive emotional states and you wanted to feel better, right? You're feeling good, but you want to feel better, right? Or you get testy, right? You test that personal control. I think I can have one more smoke or drink or just a little bit of this. And you test that personal control that you've been maintaining. You just going at it because you know what you feel that, oh, won't hurt. And then you get those strong temptations or urges. Just you get those cravings, those cravings to use. It just overwhelm you. And so you don't have anything else but these cravings consuming you. And you just give in. But also a big one too is when you get into some problems with people, some conflict with others, an argument, a spouse, a partner, and then you're not feeling yourself or they're tearing you down and you just feel like, you know what, take me away. Take me away to a place where I don't have to see this person. I don't have to hear anything negative. It's just something I don't want to deal with. Or I've let somebody down, or I've always failed at this and it never seems to get better, right? So self-criticism. It's also the social pressures, right? A situation where it seems as though everyone else is drinking or doing drugs and you're not there. So you're going to relapse because, hey, you know what? I just want to do it. It seems like everybody's doing it, so what? I'm all right? And then there's also when you're having family outings, celebrations, and then you just loosen up a little bit. And next thing you know, you're up there doing what you used to do that's not good for you. So you took that celebration, right? And broke the cardinal rule of abstinence. You just relapsed. And it's important to identify these triggers. Develop positive ways to make these risky situations easier to deal with. And that could be avoiding. That could be finding alternative activities, right? That could be no means no. So if you're on this path to recovery, right, you have to understand that there are going to be blocks along the way, barriers. Doesn't mean you can't get over them. They're just going to be real challenges. It's not going to be a straight path to the top. They're going to be slips. There's going to be relapses as you travel down that road. So you have to think about that and work through it, right? Figure out, put it like this. Always say that you're on a path and you've set this goal, and this goal could be working to the top of a hill, right? Your goal is to climb this hill, and you've set this goal for yourself. However, you know that while you're climbing, you're going to come across a lot of obstacles, but you are determined and you understand it's going to be a journey. And while you're doing this hill that you have to climb, you might have a mudslide, you might have torrential rain, you might have lightning, you might have cold weather, things that are going to slow you down. You might come across an animal, a wild animal, but you got to understand that you've got to get to this hill. This is something that you have to do to make yourself better. So when you start out, you have to ask yourself, where are you? Okay, point A. And that's where you make the critical decision point. The slips. The way down is always easier, but at the cost of having a more difficult climb the next time. Okay? So you want to be improving, moving forward, right? So you need to know that you are able to reach the top. And you do that without slips, without relapse, and you make it. However, that's where your thinking stops. You've reached the top of the hill, you've achieved your goal, boom, victorious. However, no, that's not it. This is a lifelong thing that you have to be aware of. So the hill was just one battle. Life is the other battle where you have to keep yourself in check. You have to maintain, you have to be aware, and you have to understand that this has to be something that could be worked on and can't be ignored for the rest of your life, possibly. Right? Like, if it's gotten out of control on any occasion, then you're going to have to come to that realization. It's not a one stop shop. So consider help from partners and families. That could be definitely useful, right? So when you know that someone in the family has a substance use problem, it's going to be problematic and it's going to affect everyone. And family members, when they encounter the problem, they're not going to understand what's going on. The person with the problem might not see their use as a problem, or they might not completely be transparent about what is going on. And so, as the family members get some clarity and they realize this is definitely a problem, they might have some different ideas on how to deal with this problem. And they might struggle to balance their desire with yours, meaning that they're going to be in somewhat conflict because they're going to go, well, listen, we want to help this person, we want to take care of this person, to protect this person. However, on the other hand, we want this person to be able to take responsibility for their behavior. So during this transaction or discussion or thought process, they may feel some shame and guilt, grief, depression, feel a loss of control and anxiety and anger, and even resentment, and possibly experience denial. Some people do, they experience denial. Family members do that too, especially if it's parents and they say, oh, nah, it's not so big. Some of them do that. And if the problem becomes worse, they might feel hopeless, right? There might be some communication breakdown. Conflict could just escalate out of control, and even relationships could be tested. You know, there could even be some role reversal here, a shift in roles and responsibilities. You know, efforts might be put forth to help that person, clean them up or rescue the person with the problem. And, they might hide the problem from others. They might even start getting in on that threatening or nagging the person, right? If you don't do this, if you don't stop, I'm going to kick you out. It's a big one, right? You have a child, teenager, they're getting a substance abuse, and parents, what do? I can't take it anymore. It's ruining this family. If you don't get help, get out. I don't want you here anymore, right? And what do you think that does to the person? Especially if they start grabbing their drinks and, you know, taking a tally of the drinks that the teenager has, for example, right? And calling them out on it every time they sit. The person's going to get agitated. They're going to want to run. They're going to want to escape, right? And they continuously checking how the person is using, you know? And basically, family members might want to just control their use. And it has happened where they increase their own substance use because of these problems that are going on. Well, you know what? Families, thank goodness for families and friends and loved ones who are supporting people who have addictions. I want to say thank you to a lot of them. You should be thanking yourself. However, what we need to understand is how families can help. They play a very vital role in recovery. Most people with support from families, they're more likely to stay in a treatment situation and have a successful outcome with family support. Um, it is possible. However, families need to make sure that they're caring for their own needs first prior to providing support. Make sure that, um, you are well in control of your own issues and not enhancing the situation with negativity or blame, or just doing substance use around the person, the individual. Make sure you're not encouraging that behavior. So, how do families help? Well, they need to look after their own physical and mental health. And in order for them to do that, they have to set limits, decide what they will or will not do, and let that person, the substance user, let them know. Send them a message. Send them a message to that person to take control of their behavior. Because often family members have a tendency to rescue by covering up or not allowing the relative or partner to experience the consequences of their actions or their use. you know and this, it can reduce motivation for change and even make it easier for the person to keep using, right? When they don't set these limits, they just keep allowing it to go on. Not allowing it, but just basically being observing it, maybe afraid to address it or talk about it, right? But if you are going to be a family member, set your limits, make time for yourself, keep up with your interests outside your family, apart from your partner or your family member. Don't let your life fall apart because their life might be having some serious challenges and you feel that you got to give your all and everything. No, consider seeking support for yourself, even if your relative in isn't in treatment. You got to understand the problem and the impact it has on you will help you cope if you get, some sort of counseling or advice. You could get some therapy for yourself. You could join a self help group if you're a family member, right? Local community addiction treatment center. They could be helpful. You got to take a look at your own substance use as well. It's nice to point out the finger, but hey, man, if you're drinking a lot and you have a child that's there drinking a lot, and it's not just because it's access, it's what they're seeing. How can you talk to me when you got the same thing going on? It's hard for me to understand. Realize that your own drug use could be a trigger for that person who has a problem with substance use. Acknowledge and accept that sometimes you will be angry or you'll have some negative feelings about the situation. You got to acknowledge that. Having these conflicting emotions, it's very normal. Knowing this can help you control some of your emotions when you're responding to some of the needs of this individual, right? Protect yourself physically and emotionally and financially as necessary, especially when there's children involved. Keep safe. Make sure you are, because people with substance use problems, oh my goodness, I could tell you, like, even in my own situation, I've seen family members who've had some real challenges, and because of this addiction, they've crossed some serious boundaries and they've actually threatened. It was out of control. Threatened, they've stolen, right? They continuously been aggression in the home, and the aggressiveness is just unbearable at times, right? And you want to help, however, you're trying your best, but it seems like the person is becoming more threatening, and that's an alarm bell, right? When you're not feeling safe. So you have to protect yourself physically and emotionally. Don't get baited. Don't get trapped into every argument because the person is trying to defend themselves or their actions. Be aware of that. And financially, listen, do not, and I'm telling you right now, do not leave your bank cards out there. Don't leave money sitting around. Don't have items, lock certain things up. You might have to. I don't care. You might have to. If you have valuables, remove them, right? Because they're going to go, right? They're going to go. Somebody's going to grab them. Somebody's going to get that habit fed. You know what I'm saying? And they need resources from it. If they're not functioning, earning their own, they're coming for yours. And I know it's not all cases, but it happens quite often, right? You know what I mean? And keep up your support network, your own support network. Don't isolate yourself because you're ashamed or embarrassed of what your partner or your child or family members doing that you live with. So you're trying your best to isolate yourself, to keep out of touch with friends and family in the home, and you basically think that you can work it out yourself. Try to keep your network going, your support network. Let them know, got a problem. I'm sorry, it's embarrassing, but guess what? I need help. I need help. I need support. You know, don't let the problem take over your life. Too many people let it take over your life. Yes, you can commit some time to it, and you will. However, you can't do anyone any good if you're down in the dumps all the time and you're struggling yourself, because it can be draining trying to help. But having a relative or partner with a substance use problem can strain the relationship of family members who are not using, who don't understand what's going on, who just want to fix, who just want things to return to normal, right? They see the problem differently and interact differently with the person with the problem, right? And family counseling can help. It can help with some unity in the family, enable family members to support each other when dealing with someone who has a substance use problem, right? And if you're trying to get help, see, this is the thing, especially if you're dealing with an adult, you're trying to get them some treatment, right? It's hard to do that a lot of times because they have to be able to accept it. Even if the person doesn't realize they're a problem, it's a struggle. But treatment does help, right? You know what I mean? It has to come from someone that they trust and care about. That recommendation for treatment, when you're dealing with someone who has substance use problems, they need to be hearing from people who they trust and matter to them. Not all cases, but often, because it's a very sensitive subject, sensitive issue. They can encourage a relative or partner to take some action. It's concern and support is the most effective approach to take, right? Just make sure that when you are approaching, of trying to find ways how you can help them, right? They, you got to go back to sensitivity and compassion. Pushing too hard or suggesting treatment or other action strategies before a person is ready can definitely backfire and lead to resistance or to any change. Find out what part of the problem your relative or partner is least resistant to changing. If they're willing to take some sort of step, that's a good place to start. You know, um, it's the blame game is not going to help. Use some discussion to start the person thinking about getting help. Light conversation. Find out about addiction assessment services in your community. Do the work before you start even thinking approach, because you might get information from the people or the professionals who can make some recommendation on how to approach. If it's severe, uh, it might have to come from an outside family member, the recommendation, this push for treatment, right? You know what I mean? It could be even the workplace. Some employer could say, hey, listen, you know what? You're going to have to take some pressure to change and obtain treatment may also result from legal difficulties or other related problems, right? They might be angry because they're being pushed into treatment, right? They might even get a lawyer, or they might start saying that it could go all kinds of ways. You know, you know what I mean? Like it could really get into some serious problems, but we cannot be afraid if we're really in a supportive role. We have to be upfront, supportive as much as we can without giving our own lives up. You want to feel some hope and optimism. You know what I mean? And you want to appreciate and understand how hard it could be for that person who has substance use as a problematic way of dealing with their lives. Your positive encouragement helps to support the person towards change. So, how could you help that person? What can you do to help your relative partner? Learn as much as you can about the causes, signs, and symptoms of the problems, substance use. Like, just learn as much as you can. Understand how you can support your relative in recovery. Communicate positively, directly, and clearly. State what you want to happen rather than criticizing. Avoid personal criticism, right? Don't criticize. They want to be accepted. They know there's an issue if they're ready for that change. Encourage your relative or your partner to follow a treatment plan. You know, if you got to drive them, drop them off, pick them up. If you can't do that, get somebody to help them. And they might need a little bit of assistance. Ask your partner how you can be supportive. Don't just assume. Ask them. How can I create a safe environment? Would you prefer if I remove this stuff? I know I drink too. Would it help you any if I just don't bring it around here? Is that going to help at all? Can I get rid of that cart that we have there that holds the alcohol? The bar cart. Can I get rid of that? Oh, you paid a lot for it. I get it. But I think it's best if we get rid of it, right? You know? And as they start to recover, encourage them to begin to take back some of the responsibilities that they probably let go of that might have been disrupted during this whole thing. Getting back to the healthy parts of their life. Like the family, the friends, the work, the hobbies. Help them. Recognize that recovery may not be completely smooth. Relapse is often a part of the recovery. Have a realistic expectation and encourage realistic goals. Simple, realistic goals. Encourage those. Don't put big pictures in them. Oh, you're going to do this, that, that. Simple. Keep it simple. And give hope. No matter how difficult or challenging the struggle will be, let them know that recovery is possible and it's going to be a journey, but you're willing to support them through it. And you understand that it's going to be okay. Just keep in mind that when it comes to your relationship with a partner, substance use problems can really impact a relationship, especially an intimate relationship, because there's feelings out there. Feelings of resentment, anger, a loss of trust, which could lead to distance and some sort of hostility in the relationship. See, a non user might feel that the user is betraying them to some of their previous actions. They might have taken more responsibility and it doesn't seem fair. Like, why do I have to take care of you? It's your problem. You have this problem. You're taking my life up, right? This is really realistic for the non-user. They might I'm with you, but it seems like that's all I'm doing anymore. I'm supporting you. So that's why I said it's so important. Don't give your life up for them. Support them as much as you possibly can, but keeping yourself functioning well and being realistic about what role you can play. Because, it's not hard for someone to understand that a partner who's not using could, right, feel some quiet resentment, and these problems, if they don't stop or reduce, over time, the patience will wear thin and it could be a lost relationship, you know, and they just don't want to put up with it anymore. And it has broken up many relationships because of the responsibilities or neglect or ways that the other person isn't functioning anymore. That was previously creating a healthy situation. They're not there anymore. So they're up there trying to cope with this. They're, a lot of their responsibilities falling on the partner. And the partner, it's, they just feel overwhelmed. They've got other responsibilities, and you might be just too much for them. So, if you can get your partner to meet with your counselor, that's great. Forcing them is not going to help, right? Support groups, they can also help, right? But it depends what stage you're at. We've talked about the different stages, you know, that's important. We've talked about the different stages, right? And understanding the stages and where you're at in those stages is vitally important to moving towards a positive, healthy lifestyle. And you might move in and out of those stages. However, you are going back to understand yourself more. Each time you're learning from each stage with the understanding that you are not giving up. This could be a lifelong fight. And I want to say thank you to my listeners. Part 2, addictions. And I think there's a little bit more that we need to cover with addictions. We're going to be going into part 3 because we have to talk about children, right? We have to talk about what do we tell them? How do we work with them to see that everything's going to be okay? How do we alleviate some of their fears? How do we reach out to them? Talk to them about their feelings. There's just so many things that we got to talk about still, but we're going to do that in the next podcast. I want to say thank you to my listeners. Spread the word. Be like that wise old bird and spread the word, please. Knowledge is power. So, until we speak again, I'll talk to you. Thank you, my listeners, and take care of yourself. This is Addictions Part 2. Take care.